I'm Dr. Erica Bove, and welcome to the Love Science podcast. I'm your host, and also the founder of Love Science, Thriving Through Infertility. I'm so excited you're here today. With over a decade of experience helping thousands of women just like you, I empower professional women to build their families with confidence and compassion. Let's dive in. Hello, my loves, and welcome back to the Love Science podcast. Today, we're going to talk about a very important topic, which is chronic inflammation and oocyte quality. We know that chronic inflammation can lead to changes in oocyte quality, folliculogenesis, hormone production, and immune signaling. This is likely related to meiotic and cytoplasmic oocyte maturity, which we know can affect developmental competence, both of, the egg prior to fertilization, because we need mature eggs to be fertilized, and also developmental competence of the pre-implantation embryo. Now, many of us learned in medical school that there is acute inflammation and chronic inflammation. Acute inflammation is very important, right? Say we have a cut, right? And then we get all the repair mechanisms that heal that area. That is the acute inflammatory process. But chronic inflammation can be much more destructive to our bodies. We know that when we have chronic inflammation, we get colonization of the infected or injured areas of the body with monocytes, macrophages, and lymphocytes. And we also get proliferation of connective tissue and blood vessels. When this happens, we have enzymes and cytokines that rush to the area. And over time, that can do long-term damage to cells, tissues, and organs. Now, we know that some inflammation is important to allow the fertility processes to happen, right? We need this for egg health. We need this for implantation. There's the whole field of reproductive immunology, which I think there is a lot of promise for the future. As of right now, we don't have a ton of data-driven treatments, although I think we can all acknowledge within reproductive endocrinology that the immune system and inflammation is important in the process, right? But I think that immune upregulation can also cause a lot of destruction, and we should talk about some of the factors which can lead to that. I get a lot of questions in both my medical practice and my coaching practice about the role of lifestyle factors as pertains to chronic inflammation and overall fertility. Now, we know we have really good data that lifestyle factors such as smoking, exercise, diet, and sleep play a critical role in both fertility and chronic inflammation. In terms of diet may either increase or reduce the progression of chronic inflammation. We know that diets that are high in salt, also diets that are high in saturated and or trans fats with a lot of processed foods such as refined starches and sugar, they have been reported to contribute to systemic inflammation. And by contrast, foods rich in omega-3 fatty acids, fiber-rich diets, and antioxidants, those turn out to be key players in anti-inflammation. We also know that adipose tissue, in and of itself, is a highly active endocrine organ. And we know that obesity can lead to chronic inflammation. And that's actually been really one of the targets of a lot of research recently in terms of the overall environment for women who are trying to get pregnant, as well as egg quality in and of itself. Now, physical activity in moderate amounts can be very beneficial to the process as well. So it's really interesting. There is actually some data, much of which is in animals, but looking at what happens when you have animals exercise over time. And when we do engage in moderate exercise, we can see basically cytokines that increase or decrease when we do these things. And there's some data looking at an improvement in fertility when rodents were exposed to, regular exercise, as well as a reduction in CRP levels. This data has also been shown in women with PCOS that regular exercise can reduce CRP levels in them as well. I will also say a lot of the newer data about GLP-1s in people with PCOS shows that pregnancy rates increase, sometimes even before the weight falls off, which does suggest that GLP-1s are interrupting the pro-inflammatory pathway. And perhaps that's what's most destructive, obviously we need to pay attention to obesity for many reasons in terms of maternal and fetal risks, but perhaps a lot of the pathogenesis in PCOS, even in IVF settings, is related to inflammation. Now, smoking is a whole other topic altogether. Fortunately, I don't see too many people these days who are smoking cigarettes. I do see a lot more that are smoking marijuana. But if you look at what smoking is doing at the level of the egg, it actually causes DNA methylation changes in the granulosa cells. And this was a study that was done in IVF patients, and that looked at smokers versus non-smokers, and it was a lot worse in the smokers. Also, there's some mouse studies looking at how cigarette smoke actually can lower reproductive success, both in sort of more spontaneous settings and also IVF settings. Interestingly, even exposure of mice to cotinine, and the mouse oocytes to cotinine, which is one of the major metabolites of nicotine and cigarette components, showed that can affect the extrusion of the first polar body, which we're getting super nerdy here, but we know how important that is in the meiotic processes of egg maturation, and also subsequently there's fertilization, right? That happens as well. And so I think that if we're thinking about, again, developmental competence of the oocyte in the early embryo, we know that because cotinine increases oxidative stress, it causes abnormal spindle morphology and chromosome misalignment, that there may be some data that lead to a pathogenesis of aneuploidy as well. We talked a little bit about the effect of diet, right, on oocyte quality and reproductive outcomes. I am so excited to be living in a time when we are doing so much research on the gut microbiome and fertility outcomes and oocyte quality specifically. And so I think we're going to see more and more evidence coming out about how the foods that we eat and the gut microbiome are so intimately involved in the inflammation that we have and the pro-inflammatory signals. And the nice thing is this is actually a modifiable factor, right? So if we can eat the foods that are good for us and change our microbiome, I think we might see some beneficial effects in fertility. Now, let's talk a little bit about autoimmune diseases, right? We've long known that autoimmune diseases are not good for the fertility system. It's been a little bit hard to pin down exactly why. So we know that women who have other autoimmune diseases tend to have worse outcomes, right, in fertility, whether it's outside of IVF or within IVF. And some of that may be because there's also autoimmune antibodies to the ovaries that are just really hard to measure. Like we see this a lot in primary ovarian insufficiency, where somebody may also have Hashimoto's and they may also have type 1 diabetes and other autoimmune issues. But I do think that, when we think about even if somebody's ovarian reserve is normal and they have an autoimmune condition such as rheumatoid arthritis or, SLE, which is lupus, we will often see, worse egg quality in those patients. And it can be, more of an uphill battle to get pregnant. And what we say is, if those conditions are controlled, we often see better outcomes, which is likely related to the autoimmune and inflammatory pathways. Now, I will say that I've thought for a long time that endometriosis may have an autoimmune etiology. Regardless of the etiology, we know that endometriosis and inflammation go hand in hand, right? And so when the menstrual blood is in the pelvis, it creates inflammation. The body has a hard time getting rid of that tissue, and then we can get all sorts of cytokines and scar tissue formation. And we know how much damage endometriosis can do, to egg quality and also the overall environment of the reproductive system. And so I think we're going to be seeing more and more data about that. But I think understanding the, maybe breaking the the inflammatory pathways of endometriosis can be quite powerful in, helping people finally get pregnant and stay pregnant. And then also, even PCOS, it's interesting. Like there's even some emerging data that women with PCOS are more likely to have other autoimmune conditions and positive ANAs and anti-TPO antibodies. And I think that as we're looking at long-term clinical management, I think that we may be looking at this more and more. So why is it that inflammation is so hard on the system? I think there's some proposed mechanisms. One is that there's a disruption of hormonal balance, right? And we know that when there's chronic inflammation, that can interfere with hormone secretion. It can make the hormones bind less well to the receptors, and it can also activate the HPA system as well, right? So it's like kind of this self-promoting cycle. Is it the chicken or the egg? But when our adrenals get involved, we have increased corticosteroids, and we don't sleep as well, and there's like this whole host of positive feedback loops that can get involved. Also, insulin resistance. We know that when people have chronic inflammation, they can often have issues with their metabolism hormones, such as leptin, ghrelin, insulin. And again, that's perhaps why these GLP-1s are, so effective. But I think that we really need to think about the link between inflammation, metabolism, and fertility, because it's really a window of opportunity. It's also really interesting when we think about chronic inflammation at the level of the ovary, right? So we know that chronic inflammation can alter the immune cell population in the ovary, both in terms of cell types and the ratio between the different cells. The thought is that the cytokines that are affecting the immune cell populations of the ovary can do long-term damage over time, such as ovarian fibrosis, problems with meiosis, and can lead to oocyte attrition and inhibit folliculogenesis, right? And we know that all these things are related to infertility. And so, I would love to see more on chronic inflammation and, recurrent implantation failure and the level of the endometrium as well, because I firmly believe that when we can manage chronic inflammation, we can have improved fertility, much of which is at the level of the egg and egg quality, but I think it's also systemically important for the overall environment of getting and staying pregnant. So what can we then do to help with these issues, right? This chronic inflammation, like even stress in and of itself can lead to chronic inflammation. I think that there's a lot of power in the food that we eat, right? And so if we can eat food that is rich in antioxidants, right? Fruits, veggies, food that's not processed, that is going to go a lot farther for us than eating foods from the middle of the grocery store, which we know can really create inflammation, like, white bread, white pasta, a lot of those foods that maybe we grew up with, but they're really not as good for the system. We can also, stop harmful behaviors such as smoking and perhaps drinking and marijuana use, because we know that those induce free radicals and really, undo a lot of the good work that we're making with other lifestyle choices. So if that's a factor for you, really make sure to get the support that you need to be able to get on a better track with that. We can also start taking antioxidants, right? So there's coenzyme Q10, which has been really touted recently. Oh, not even just recently, it's been a while now, but there's good animal and human data that coenzyme Q10 or CoQ10, 200 milligrams times a day can really make a big difference in egg quality. And even vitamin D, right? There's been some studies looking at vitamin D and egg quality that can be helpful as well. So I really think we are just starting to skim the surface in terms of research about chronic inflammation and egg quality. But, I think, like I say at Love Science, we have to identify what can we control and what can't we control, and what's the wisdom to know the difference, right? That's the serenity prayer. Grant me the serenity to accept the things I cannot change, the courage of things that I cannot. God, grant me the serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference. Wait, we say that all the time, no matter your persuasion, right? Like there's so much wisdom in that prayer, because if we can identify what's in our control and we can identify what's out of our control, and then we can have the wisdom to know the difference, then life just gets a lot easier and we stop resisting reality and we take back our agency, right? So if we can really think about chronic inflammation and reducing our stress levels and sleeping better and stopping any habits that are harmful and making sure our diets, not 100% of the time, right? We're not aiming for perfection, but most of the time we're doing kind of what's good for us, good for our bodies, good for our microbiomes, good for our egg health. Then we start to see meaningful changes. And so I hope this was beneficial to you, and we will talk more about inflammation in the coming weeks as well. Remember how much I love you. Bye.